Dr. Brian Prax from Chronic Care Charlottesville is here, and we were talking a little bit about opioid addiction. It's in the headlines, but I think there's a lot of mystery for folks that hasn't touched them directly. Brian, give people a little insight as to what opioid addiction, the headline-grabbing little bumper sticker slogan, really means.
Well, yeah, just to state that the CDC indicates that 2 million Americans a year are addicted to or having serious problems with opioid. But check this out, the Virginia Department of Health, now this is just statistics for the state of Virginia, 822 opioid overdose deaths occurred in the first 9 months of 2016. Now, in the entire year of 2015, there were 811. This is a major problem, and these are just opioids. These aren't any and all other medications. It is growing, and it is a serious problem.
What is an opioid? Everything and anything?
Everything and anything. It's a specific type of medication that stimulates the brain and releases, feely-good medications. And in the right application, for the right time, for instance, my brother dislocated his shoulder very, very badly, and nothing was working. They gave him an opioid. And boy, it really, really helped out. But he knew and was afraid that, wow, this thing works so good. I better get off this quick because it works that good.
Is it the classic example of hiding the symptoms of an injury, the pain especially, rather than healing it or while it's being healed?
That's exactly right. And that's a totally appropriate. The case of, like you mentioned, a herniated disc, a dislocated shoulder, somebody in the military got shot up. They're going to use their opioids, morphine, things like that in order to help get them to safety, get them out of pain so that they could do the actual real healing behind that. But the problem in America, Virginia included, is that people are getting hooked on this. It's very, very addictive, very, very addictive.
So what does a holistic approach to fixing it look like? Can you help people get out of that pain chiropractically?
Yeah, actually, most of the time you can. And the analogy that I use for patients is like, if needed, an opioid medication like others is analogous to your house is on fire. You need to call 911 and get the fire department down there. They're going to come with their hoses, their water, their axes, and chainsaws. They're going to put out the damage. Then somebody's got to go back and you got to repair all the damage from the firefighters, but also from the fire. What's happening is that people are getting addicted and more damage is occurring, even death. So it is something that the Virginia Department of Health and the CDC is very, very concerned about. But yeah, look toward measurements and means in order to correct underlying issues.
If the doctor that's prescribing it isn't working towards relieving the pain, if they're not saying, okay, while you're taking this, we're going to do some other regimen of therapy, is that a warning sign that you might be in trouble? And you should be looking for doctors who are saying, okay, if we do this many times, your pain will go away on its own?
Yeah, absolutely. It's a time to start looking for another doctor, other means, looking at chiropractic, acupuncture, physical therapy, exercise, yoga, stretching. There's a lot of things that you can do, Joe, but really instead of just covering up the symptoms, I really think that somebody needs to look towards solving the underlying problem.
And you have programs that work on that kind of pain relief. I've seen the videos on your website about knee pain, back pain relief through some of your processes. How do people get in touch with you?
ChronicCareCharlottesville.com. We even have a YouTube page, as you mentioned. We have nearly 300 videos on there, and all of them are related to chronic pain and getting yourself out of that.
Excellent.